Afternoon. I thank everyone for joining us today to attend our webinar, Rooted in Faith and Community, Messaging for Leaders to Advance Health Equity. As part of today's presentation, we have included some enhancements and additional components. So if you attended our first webinar a few weeks ago, fear not, we have added some new things and we have some new things in store for you. We will be recording today's presentation and will distribute to attendees following the event. Today's event is made possible through a collaboration among a host of community partners, including the Eastside Health and Wellbeing Collaborative, mHealth Fairview's Interfaith Health Collaborative, and the Network for Public Health Law. I wanted to extend a huge thank you to our collaborators, presenters, and partners for today. So before we jump into today's webinar, I wanted to share some quick housekeeping notes. First, we invite you to use the chat box function to ask questions throughout today's presentation during all of our speaker sections. We will be spending some time at the end of our event having a moderated question and answer session. So just want to encourage you to use that chat function to ask any questions or share any comments throughout today's event. And at this time, I'd like to turn things over to my friend and colleague, Mr. Gene Matthews, who will be getting us started with today's presentation. Gene, the floor is yours.
Okay, I'm unmuted. Do you hear me okay? Thank you very much. Thank you, Christina. I'm also greatly indebted to Sarah Rogers, who's done all the heavy lifting to help put these webinars together, and also to Ann Ellison, also with the community organization. It's been very fundamental in making this come to pass. I'm Gene Matthews. I'm with the Network for Public Health Law based at University of North Carolina in Chapel Hill. Previously, and we're also thanks to some of our technical folks in our national office for serving the platform for today. I previously served before coming here as Chief Legal Officer at Centers for Disease Control, and we're working in the world of Network for Public Health Law. Joining me today, then, you've already met June Blue, who is a blessing grandmother with her tribal nation and her community. And she is going to talk in the program today regarding lessons from the Indigenous community pertaining to this messaging and pertaining to equity. So we're delighted to have her. Following June, after I talk and after June talks, and Dawn Hunter will be on the program. Dawn is Deputy Director here for the Southeastern region of the Network for Public Health Law. She's currently in St. Petersburg, Florida. Before that, she spent significant time in New Mexico as a state health official and as an attorney, and has a lot of leadership skills to help us negotiate through this. And then finally, I've got my good colleague, Dr. Gary Gunnison, who is really a national thought leader in faith-based health matters. He comes out of the Carter Center. He was there and recruited by some of the same people that recruited me in Atlanta, Georgia. He's done then work in faith-based health at Memphis, Tennessee, and now he's at Wake Forest Baptist Medical Center in Winston-Salem, and has a faculty appointment with the Wake Forest University School of Divinity, and I believe School of Medicine. And Gary will take us home with, you're in quite a treat to hear Gary. So let me sort of point out again, we will save 30 minutes at least at the end for engaging question and answer. We did this before, and we got plenty of robust questions and comments and discussion on this. So we want to give you time to engage us in this program together. I'm just very pleased that we could put all this together today through these remarkable connections, and we're really excited to be exploring new ground to new audiences, including your Minnesota communities and organizations on messaging to advance health equity in this very challenging time that we're in. So our goal today is to give you some tools for deeper insight into becoming more authentic and trusted messengers to your communities in these very challenging times. So if you want to advance the slide, please, then next slide, please. Yeah. So I will give a overview of moral foundation theory and how it applies to this situation and sort of beginning to open a conversation for something deeper that's taking place here. So next slide. Back the previous slide. The Becoming Better Messenger slide is next slide. Yeah. Because they jump on us. Okay, I understand. Becoming Better Messengers is our web page where we have a lot of additional information on this and links and so forth if you want to know more. And our PowerPoints today are we will make them available to you in PDF afterwards and send them out. So next slide, let's then take some quick glimpses at moral foundations. And many of you took an online self-assessment tool. So I want to jump right into this. This was prepared with results from 74 of you in this audience and also part of the previous audience that were submitted during the previous month. And this sort of shows how you collectively scored on these 6 foundational values that I'm going to be talking about for about the next 15 minutes. And as you can see, you folks score really high on care and fairness. You really, even more important to us, and we'll get to that, you score really strong in the other 4 values: liberty, authority, liberty, which is the second one, loyalty, the 4th, authority, the 5th, and sanctity, the 6th. So this is real important. Let me show you. Go to the next slide, please, Sarah. So we've been doing this for some time now in North Carolina, in a number of different communities, and we've done this program nationally as well. And so this was a snapshot of the North Carolina public health workforce taken before COVID. And so you can sort of see where we stand on those values, mostly in the 2s and mid 3s and mid to low 2s. So then we're going to show you a slide after COVID that was done in October, which is the next slide, and see how it jumps up. And if you would just sort of toggle back and forth a couple of times between the previous and this one, Sarah, you're going to see that's before. And then after COVID hit, see, these scores are going up. And these are not by the same people that took the test a second time. They're in our workforce here in North Carolina. But we're still, Barbara Martin is doing her dissertation on that. She had a conflict today. And so I'm being the ventriloquist for her on this and presenting this. But we still need to get some clue as to what the statistical significance of this trend is. But let me show you one more slide just really quick, and I'll stop geeking down into the technical stuff. We did a slide earlier this week, right? Yeah, with the North Carolina League of Municipalities. And they are the elected officials in town, city, municipal governments in North Carolina. And they scored a lot closer to you on these values across the board. So I won't toggle back, but we're starting as we're reaching out with you in the faith community. We're also taking this work that we've been doing for a number of years and reaching out to elected officials and appointed decision makers to build these bridges that Gary's going to talk about to other communities to move things along. So next slide. So you may be wondering, why are there two lawyers on this program talking about messaging to faith communities? And this is the framework that we use in public health law for how to change law and policy in order to deal with the dynamic situation of everything in public health changes, as we've learned rather difficult lesson the past year, and it's going to keep changing. And so in order to meet these changes, then we've got this sort of 5-step model that we do, which is an interdisciplinary collaboration that's needed, not lawyers in a cave somewhere with a stone tablet chipping out legal opinions. We've got to get out and engage the community. And to do so then, the second oval there, we need to design and select the right solution to deal with the problem that has come upon us. And we can't spend all our social and political capital on 20 different solutions. We've got to pick the right one. Number two, then we have to do the advocacy out with the communities and then with the elected officials to build the consensus and make the change happen, whether it's a law, a policy, a regulation, an appropriation, a funding mechanism, or a structure that's got to shift. And then the fourth oval there is we've got to implement and enforce this and get it up and running and stick with it. Now, to do all these things, if you don't have good messaging that communicates to interdisciplinary groups and to your community, we're wasting our time. So that's sort of the piece. So what we're wanting to do today is just sort of take a deep breath and try to give you some tools that will give you a better insight into how to be a better messenger and how we can help each other do this. So next slide. Just looking at where we are with that big deep breath, it takes my breath away. Look at this perfect storm. We've got the coronavirus pandemic that's hit us. It then triggered, just sort of moving clockwise, triggered the economic crisis that we're all trying to shovel our way out of, and the political leaders are very much running back and forth on this. It has then shined a laser beam on structural racism. You are the community where George Floyd died. You don't need to be told this. You knew it before, but the light is just shining on this now, and the country has to deal with it, which leads us to sort of the 7 o'clock position there, our polarized democratic process. And it was 7 weeks ago, we witnessed this insurrection on Capitol Hill on the day of the Electoral College voting. So we are having these crazy times. A lot of it is fueled by social media and just the way we communicate with each other. And then hovering over there in the batting order, the last one is climate change, which we just saw, this past week, the impact of that on locking up the state of Texas, both the electricity and the water supply. And those steeped in public health know that changes in climates trigger new emerging infections. So we don't know what else is around there. Now, not only are we in this target, but you in the faith community and dealing with community coalitions and trying to deal with those communities in need are being hit by all 5 of these together. So next slide. In our public health world, this is a really nifty tool that the Beaumont Foundation put out some time ago called Phrases. And it gives you good examples of words to use when you're trying to message public health. And those of you in this area, I commend this to you. But what we're doing is trying to go a step deeper today into what is going on below the surface. Okay? So that then takes us into the path that some of us have gone down. Next slide, with Jonathan Haidt and moral foundations theory, which gives really a good way of getting insight into what is going on and how we can have better awareness, and then how we can resonate to communities within a respectful way. So his 2012 book, The Righteous Mind, Why Good People Are Divided by Politics and Religion, talks about how many of our decisions are intuitively driven, and our social and our political judgments are particularly intuitive. And where our rational brain is not really conscious of that. It picks it up and deals with it like the little person sitting up on top of the elephant, sensing that the elephant is leaning right, and tries to make going to the right happen. But the rational brain thinks it's in charge. But in many of these, it's our intuitions, our instinct that go back in our family of origin, how we were raised, our culture, and really go all the way back from the time our ancestors moved out of caves into the Serengeti plain and became social creatures. So next slide. Haidt did some really, really interesting work. And he laid out 6 foundational moral values that we all tend to resonate with to one way or another. And this work that he did is very, can be replicated. It's very sound. And he had done it in a lot of different, getting his dissertation at University of Virginia, and then doing postdoc work in Pennsylvania and going overseas. He did it in a number of different cultures. He came back to the U.S. and he did it here and found out the most interesting things. So these are the 6 values that were on that quick little 5-minute self-profile that you did, where you saw your results, which is all IRB protected confidential, but we show your profile, and I will show it again in just a minute. So what are those values that just, graded my mortal soul here? No. This was just a quick Myers-Briggs. There's no right or wrong answer. So going through this, the care harm value, each value has sort of a reciprocal to its dimension, and they pair up together. Care is, and again, these are pretty easy to understand. This is easy to teach in a skill building workshop to a frontline public health workforce. Care is compassion for the vulnerable, and we don't want to have tolerance for suffering in our family, in our tribe, in our neighborhood. We want to do something about it. Okay. Liberty and oppression. Liberty is from the first time our ancestors moved out on the Serengeti plain. This is nice. We like to poke around. We like to explore things. We like to do what we want to do and have choices and freedom of action. And we don't tolerate bullies very well. So Jane Goodall's work on chimpanzees demonstrated how in a chimpanzee tribe, if there's a bully acting inappropriate, that bully gets driven out from the tribe. And so in certain ways, we're like that about bullies. We like the freedom. We like to do what we want to do. And we don't want people telling us very much what we can't do unless we understand why. Fairness and cheating. People want to be treated fairly. We want to get what we deserve. And we don't tolerate free riders. So I spent time early in my legal career settling World War II claims again, by the Micronesian inhabitants out in the Western Pacific against the U.S. and Japan for things that were done during World War II. And went to some very remote atolls that were all subsistence. And the work was divided up into harvesting the coconuts and catching the fish and preserving the breadfruit. And if you didn't get to do your fair share, you could get voted off that island. And that was not a reality game when you are, 4 days by tramp steamer from an electric light bulb. So it's deeply embedded in us. The other three, then, real quickly, loyalty and betrayal. Loyalty is personal trust for our group. We're loyal to ourselves, our immediate family, our extended family, our community, our neighborhoods, etc. With social media, the click of a mouse, we're loyal to our football team, our religious group, our political party, etc. And we isolate those who betray us. Okay, and we don't trust that. So then authority is the competitive advantage of organized groups, and again, the icon there is Alexander the Great, who conquered essentially the whole world by going to the next country and, coming in. And if he had to conquer them, he had to conquer them, but he didn't enslave them. He said, come join my big red team and we'll move on to the next country and you can get something out of it too. So we like good leaders, but we do not like leaders that don't work. So we're taught, in the Marine Corps, don't subvert the system. Do what you're supposed to do, private, and don't buck the system. And the last of these is sanctity and degradation. Some of our liberal researchers now like to call it purity. I guess they get hives when you start talking about religion around them or something. But sanctity is that part of the human spirit that is elevated and pure. And we see, we all experience that in weddings and births and deaths and special events and things like that, where we do things and we act in altruistic ways. So I'll come back to these values in a minute because it's really important to how public health relates, and I think how you and faith communities relate. So next slide. Haidt found the most unusual thing when he applied this approach to a U.S. population. And he found this striking difference between U.S. political liberals and U.S. political conservatives. So this is the profile of sort of the classic profile of U.S. political liberals who score high on these first three values of care, liberty, and fairness, and score low on loyalty, authority, and sanctity. Our overarching goal here is to protect those in need. And so, and this resonates to my world in public health at CDC, because if you think back on it, when we focused on how to message better on vaccines or obesity or environmental or opioids, we talk about care and liberty and fairness, and don't go so much into loyalty, authority, and sanctity. All right. So then, conversely, and you see how high on the left, low on the right. So conversely, here's what Haidt found in the next slide regarding the conservatives. The conservatives, the overarching goal here is to preserve the norms and treasured institutions. So conservatives score fairly well on care, liberty, and fairness, but higher on the three values on the right of loyalty, authority, and sanctity. So I put this together then with sort of the money slide of put the two together, and you get this thing. Well, there are a couple of pieces to it. One, when this information is presented to liberals, they tend to scratch their heads because liberals understand that we score high on those three values on the left and low on those on the right. But they're puzzled, and they think that, and they know correctly, that conservatives score higher than them on loyalty, authority, and sanctity, but they don't understand why. They're puzzled as to why care, liberty, and fairness is a respected and resonating value in U.S. political conservatives. Now, political conservatives see this, and sure, we know we score high on these values, care, liberty, and fairness, and we know that liberals score low on loyalty, authority, and sanctity, and we know that liberals misperceive and think we don't care about care, liberty, and fairness, but we do. And so this is what Haidt in his book calls the conservative advantage, which is sort of how in the wide world do U.S. political liberals get anything in this country when they're only playing with 3 cards in a 6-card intuitive deck. And conservatives resonate to all 6 and use them effectively. So that's a piece of it. But I'm not wanting to go down the gopher holes here on politics with a big P. I want to talk about politics with a little p of dealing with our communities. So, in addition, this framework gives us insight into a significant public health advantage in this moment. And I submit it is a community health advantage. It is helpful to you in the faith communities as well. So next slide. Here's how I play it out for public health audiences. Public health understands in spades that they resonate to care and to liberty and to fairness. But these other 3, if you pause and think about it, loyalty, the heart of public health is community coalition building. We are working with helping communities like East Side Coalition be able to empower them to do what it is they find are important and how you get it done. We're loyal to communities to a fault in public health. Authority, public health is a police-powered doctrine. We don't like to talk about it enough, but if push comes to shove and a public health officer has a person in their community who is spreading viral encephalitis or multiple drug-resistant tuberculosis or something that is a real risk of infecting and causing harm to other people that can't be presented, we'll quarantine your ass, as I said the first time when I did this in the program. Did he really say that? Yeah. Well, I mean, this is with due process and all respect, but if it has to be done up in Lake Wobegon, we eat our powder milk biscuits and get up and do what needs to be done. And public health is like that. And sanctity is, again, the nobility of when others are running away from the fire, we in public health run towards Ebola or COVID. Now, I submit to you, this all holds true. You don't quarantine people in faith-based communities, but you are also in that community. And the authority, you have the moral authority, you have the respect in your organizations, you are clearly signing up for serving your community, and there is great authority power that goes with that. And sanctity, again, this is part of you dealing with the purity and the transcendental nature of the human spirit. So let me just flip back to that next, so just go forward one more. See, this is how you scored, and this is so remarkable, seeing how you score high, to me, on loyalty, authority, and sanctity. You may think you're a doctrinal liberal like most public health do. Public health don't score quite as high as you do, at least the audiences we polled, on loyalty, authority, and sanctity. And you are really high on care and fairness, and more power to you than anybody we polled. But there is real data behind these words that I'm throwing out. Okay, I need to stick the landing here. So give me the last slide. Why this is important is that community health, both we in public health, you in coalition building, you in faith-based health, have the breadth of moral values, and you can use them in a way across the political spectrum in order that people can feel safe engaging in relationships with you. We need to have civil discourse in order to build those coalitions. We need to have civil conversations, or this won't occur. And in the process, we can add value to doing public health and to helping the community and improving the civil conversations. So that's sort of where I am. I'm hyperventilating here, so I better stop and take a big, deep breath. I hope this helps, though, give you some insight. And we can do a lot of training on this, skill building training to teach both decision makers, those advocating to decision makers, and to frontline workers who are doing advocacy in the community or serving their communities to do that. So I'm at time, and I call Al, and let me pass this over to June Blue, who has some really interesting material to present. Go for it, June. Over to you. Thank you, mute. And while she's powering up, remember, I sped talk through a lot of material. If you've got questions on this, put them in the Q&A, and I see that we have one already about, we'll get to that downstream. Okay, thank you very much.
Okay, can you guys hear me? All right.
Yeah.
Am I double echoing?
No.
Okay.
You're good.
All right. So I'm going to bring a Anishinaabe, Ojibwe perspective and Indigenous. And I'm not speaking for all Indigenous people. I'm just talking from my experience as an Anishinaabe grandmother. So I'm a member of the Eastside Health and Wellbeing Collaborative. I am Green Clan, one of the two leadership clans of the Anishinaabe Ojibwe people. I'm from Whiters Nation, Gawaba Beganika, Mindunjiba. I'm a veteran, and I carry the Sacred Eagle Whistle. I headed up an initiative to bring 13 healing ceremonies to St. Paul. It was 885 people were healed. And I'm also the co-chair of the Mental Health Wellness Action Team, which is bringing cultural healing to become a mainstream practice. And this would include all cultures, be it African American, be it from Africa, Asian. So that's my process, is to bring everybody into the medicine wheel. So next slide, please. Jean had talked about the moral values, but the Anishinaabe people, this is just a different perspective too. Is the Anishinaabe people have brought these 7 grandfather teachings forth for a couple thousands of years. So the first one is bravery, which is personal courage in the face of fear. Even when you're doing something scary, bravery is needed in trying new things. Like for me, doing this today, I needed bravery and courage. So even as a 3rd generation veteran, I still feel sometimes I get kind of scared. And the next one is I was being honest with you. So being sincere, open, trustworthy, and truthful. So your actions match your words. And that means you can reflect on yourself too. So right now, I think truth is very important, and that is the Indigenous people's ability to bring forth their truth, because we haven't been able to do that. So, for an example, I was talking to a woman that was from the dominant culture, and telling her about the veterans, the Native veterans. And where I'm from, whiters, 1 out of 3 that are eligible join the military. And then I told her in World War II that even though we were at 1% of the population, 1 out of 8 people that were veterans were Indigenous. And then I mentioned that during the Vietnam War that we went to the offices. We didn't run from that. So, and she started to say, well, I think, I think they just joined the military because they wanted to go to college and get away from the reservation. And something just stopped me right there. And I said, you don't get to tell our stories anymore. We can tell our own stories. And I think I know about that military background because I am a veteran from White Earth Nation. So, we just have to be truthful and honest when we're having conversations. And humility is the next grandfather teaching. I'm admitting mistakes and learning from them, willing to learn from others, and showing compassion at all times. So humility, if you're a white person and you're going to the Indigenous population, you have to come with humility and to listen. You might have to even listen to some of the trauma that they've carried, and that's okay. To be uncomfortable. Thank you. Next slide, please. Love, my favorite grandfather teaching. Treating others as you would like them to treat you. Love is a light that never lived in a heart possessed with fear. So if you have fear, you cannot have love in your heart at the same time. Fear and love cannot be in your heart at the same time. So what I do if I feel fearful about something, then I try to turn it around and see how I can make it come from a place of love, from my heart. The Anishinaabe people say, in Endam Pendago Day, I think with my heart. So that is somewhat different than maybe some of the other nations, even the United States, about what some of their models are. So our first one is we think with our heart. So the next one is respect, is honoring oneself and others and caring for their rights. Because everybody's on this journey in a different place. So we have to honor where they're at on the journey and give them the dignity they deserve. And again, truth is looking into your heart and see what is true for you. Speaking from a truthful place. Truth is to know all the teachings. Wisdom, we cherish wisdom and we cherish knowledge. We're always willing to learn from others and about ourselves. Next slide, please. And the last one is kind of gives a overview of the difference in thought process from the mainstream culture and then traditional Indigenous culture. And I'm not saying that either one of these is right or wrong. And what I'm saying is that we have a different thought process, and this is good. To bring all of the thought process of all the cultures together is how we're going to heal. And so pointing fingers and saying that one's wrong or that one's wrong is not good, but just to honor that thought process. So mainstream culture, you can see, is materialistic. It's focused on the material. And this is okay. And then a traditional Indigenous culture, we focus on the spiritual. Mainstream culture is very individualistic. It's for me. Meanwhile, as an Indigenous grandmother, I'm thinking 7 generations down the road. And we're Indigenous culture is community oriented. In mainstream culture is achievement oriented. Like, look what I did, look what I got, you know. And for us, it's the service. Like, how can you serve? What can you do to serve the community? And the next one is adversarial. Like, you know, you have 2 people with opposing points, and you're going to go and talk to someone. And for us, it's consensus based. We all have to agree. And competition for the mainstream culture, there's a lot of competition. And honestly, like that kind of confused me a little bit. But and we believe in cooperation. Oh, sorry. Oh, jeez. In competition for the mainstream culture, and one other thing is we see the dominant culture see things in linear time, and we see it in cyclical time. It just always comes back around. And the dominant culture, mainstream culture, is primarily patriarchal, and we are matriarchal. We go to the grandmothers. We seek wisdom from the grandmothers. And for the mainstream culture, things are compartmentalized into little boxes, and we believe that everything is holistic. You have to see from the spiritual, the emotional, the mental, and the physical. And for mainstream culture, it's youth oriented. Like, young people, we love our young people. They got more energy. Let's push the elders to the side. And for the Indigenous people, the older you are, the more respect that you get. And let's see. Sorry, guys, I'm gonna have to do it on this way. So I'm gonna end my presentation, and I just wanted to say thank you. Miigwech. Thank you very much.
Okay. So thank you, June Blue, and hopefully folks can hear me okay. I hear an echo. Okay. So welcome. I know that y'all are really here to hear Gary Gunnison, so I'm not going to take too much of your time. But I want to start by sharing that I was listening to a podcast yesterday, and I actually wrote this down because I thought it was really relevant to the training today. And in this discussion about prayer, it said, if we get through this crisis, it's because of the people who made the choice every day and repeatedly to act on behalf of those who are most vulnerable, the choices that people have made every day to create an environment that is supportive of those who are most in need. And I think that speaks to the values of care, fairness, and loyalty. And one way that I think we create that environment is through messaging. And so you're going to hear me talk a little bit about equity in messaging, what that means, and how to do it. Next slide. Next slide. Yes. So I'm going to start with the question on this slide, which is, what do people want to know versus what we as public health or community health professionals want to tell them? So on here are some things that I've heard recently. I don't trust how fast the vaccine was developed. People should not be making $15 an hour to work in fast food. Focusing on racial equity doesn't promote unity. The death rate is only 0.2%, so why is everything shutting down? Behind each of these is a deeper question and a moral value or values. How do I know if I'll be safe if I get the vaccine? I'm not comfortable talking about race or racism. I don't think it's fair for some people to make more money for the kind of work they do. Or I deserve to make more money too. Or I should be free to make my own choices about my risks. There are probably many more, but I want to encourage you to go beyond what you hear people say and really get at what people want to know. Next slide. So censoring equity means that you're thinking about equity in the content of a message. So that could be a message about hospitalizations and deaths being higher in a community of color, or you're thinking about equity in the outcome of a message. For example, a message about food distribution sites and times in a local neighborhood that's put out in multiple languages. Censoring equity is important because it promotes equity as an idea and as a goal. It helps to normalize the conversation, and it helps us to reach people where they are. But I also encourage you to think about your own reasons for censoring equity. Next slide. So we're going to talk about how to create a narrative. And one of the most important things that you can do is know your audience. Studies of social justice movements make it very clear that movements are not going to happen if you are always and only reaching your advocates and champions. Everyone has a tipping point. Every movement has a tipping point. And so your messaging is really about reaching those people who can be tipped. There's an excellent book called The Tipping Point by Malcolm Gladwell that dives into examples of how movements have started, including some with a public health perspective. You also want to consider your audience values based on what we have covered so far, the moral matrix. And we all don't talk about things using the same language. I'm going to come back to that in a minute, but what language does your audience use? And then last, what's your purpose? Do you want to influence behavior? Do you just want to educate people? You have to be clear on that up front. Next slide. So one way on this slide right here that you can visualize your audience is using a collaboration continuum or a stakeholder management model. Remember that your advocates and champions, or those who are leading, are already going to be responsive to your message. They're going to do what you ask. They do not need the same message as people who are on the fence. And some people are just resistant. You are never going to reach them. Someone who doesn't think COVID is real is going to be very hard to convince otherwise. You're not trying to message to them. Or if you are, you're having to take a very different approach. Next slide. So you want to think about creating a tipping point by messaging to people who are neutral, curious, aware, supportive. What does it take to reach them? And I put an asterisk around unaware because just like on the other end of the spectrum, this group also needs a different kind of message. Next slide. So going back to identifying the language of your audience, I love this slide because I was talking to someone about racial equity and conservative and liberal positions on this, and he said, white conservatives want racial equity too. I said, yes, of course. That's what moral foundations theory tells us. So if that's true, then how do we talk about it? Because we know that not everyone is comfortable talking about racial equity or using terminology associated with racial equity. So I like this graph because messaging often targets the lower left and upper right-hand quadrant, but it misses the more heterogeneous group of people in the upper left-hand quadrant. And this is about Florida passing the minimum wage increase here to $15 an hour and re-electing Trump. And it says, I'd like to remind you of the upper left-hand quadrant of this chart I made back in 2017. Lots of voters are socially conservative and economically liberal. So messaging often fails to reach this heterogeneous group of voters in the upper left who clearly have different political ideologies, but they all wanted the same thing. So assume that people want the same things, and then identify terms that resonate with their values. Next slide. When you get started, again, lead with values. 2, connect to history. Where did the issue originate and what's the history of the community? I live in St. Petersburg, where Tropicana Field, the home of the Rays, the baseball team, they're considering moving the field, and they're talking about how to redevelop the area around Tropicana Fields. And that originally was a very thriving Black community here in St. Petersburg that was torn down. And so 1, it's important to know that. And 2, it's important going forward that it's connected to what the community wants to see happen with that in redevelopment going forward. So draw a through line connecting past to present, explain the connection between public health and social or economic issues like housing and transportation, because it may be obvious to us in public health or community health, but it is not obvious to everyone. And always focus on solutions over identifying problems. And we're going to look at a couple of examples of this at the end of my section. So next slide. One thing I really want to emphasize is focusing on places or conditions rather than people. This is important so that we don't reinforce the idea that people who are suffering due to COVID or due to other conditions made poor choices, but really their suffering is the result of social and structural barriers to being healthy and staying safe. So one example is on this slide. African Americans in this community have higher rates of diabetes. How many times have we heard that? But consider saying instead, diabetes is more common in neighborhoods that don't have access to healthy foods. Then you can get into your facts about who's affected by this, but focus on what's creating the problem and not people and their individual choices. Next slide. So this is another couple more examples of that. On the left is Dr. Brittany James, who is a physician, professor, and co-founder of the Institute for Anti-Racism in Medicine. She says, instead of the healthcare community asking how we can get Black folks to trust us, we should instead be asking, how do we become trustworthy? You build trust by acknowledging your role in creating the problem and then taking action to fix it. So that's one solution. And then on the right is from the New York Times. It's an article that says how decades of racist housing policy left neighborhoods sweltering. Redlining has concentrated communities of color all across the U.S. in neighborhoods that have less tree cover and green spaces. It isn't about individual choices about where to live. It's about the laws and policies that shape, and in this particular case, limit the choices that people have. Remember that focusing on people can reinforce the ideas that disparities exist due to personal failings or poor choices, and we know that that's just not true. Next slide. So I'm briefly going to cover storytelling. We know that this is important because of all the things we know about empathy and human connection. We know that people are more likely to remember information through storytelling. And remember also that we're not always the best messengers for community health, but we do have partners and community members who are. You want to bring your facts in later. And you've probably heard the phrase, people want to know that you care before they care what you know. That applies here. And you can use storytelling in a number of ways, including and importantly, to connect people and experiences to the data, but also to tell the story of your organization. What have you done and why is that important for the community? Next slide. So this is one of my favorite examples of storytelling. I follow Humans of New York. It restores my faith in humanity. And in this particular story, this young woman was telling about a car accident that she and her family were in, which took the life of her father. And her father was an organ and tissue donor. And they saved some of his bone as part of the process. Well, the daughter was a piano player and lost the use of her hands due to the accident. And despite multiple surgeries, they were unsuccessful in restoring her ability to play. But then her mother said, hey, we still have the bone from your father when he passed away. And they were able to use that to successfully recreate and recraft her hand. And she's now able to play the piano again. And that's really powerful. So now every time I think about organ and tissue donation, I think about stories like this, where it has a real impact on the quality of someone's life and on their connection to a loved one. So next slide. So the last couple of tips that I'm going to go through are be authentic in the way that you speak and communicate. You want to use trusted community partners again, but also think about using translators and interpreters for the languages that are commonly spoken in your community. Think about using community health workers. We call our training Becoming Better Messengers because we know, as you heard Jean say, that the messenger is often more important than the message. So that's also why it's important to be aware of cognitive biases, which you see listed here. Framing effects and authority bias. And there are two important tips here. One is that we're more likely to believe something is true if it confirms our predisposed thoughts about what is right. So be careful with your facts. And then on that point, repeating misinformation or false information can actually reinforce people's misperceptions. So a good example of this is myths versus facts sheet that health departments like to put out, like with flu. There was a study done with the CDC, and this is from the Frameworks Institute, where not only did people think that the myths about flu were true, they attributed that information to the CDC. So this is exactly what you don't want to have happen. Next slide. Okay, so I only have two more minutes, actually, maybe a minute and 30 seconds left. And one of the things I'm going to ask you to do now is to use your chat function. So one of the questions you might have is, where do we start? How do we start crafting these messages? So here are each of the moral values. And what I'm going to ask you to do is use the chat to pop in words that you associate with each of the moral values. And I'll call some of them out as you put them in. So for example, for care, you can put kindness. For authority, you can put leadership. So words like that, if you can. And I'm watching, so hopefully chat will come in and people have access to the chat. I see love. That's a good one for care. Thank you. Care, empathy, also a good one. Empathy is an important part of messaging. Listening. Empathy, another empathy. Two more empathies. Compassion. These are good. Equity is definitely one that's on the list. Equality, often people also put in as an example. Any other ones? So I'm going to actually just move to justice. Yes, and non-judging. Those are both good. So you can keep popping them in the chat. And I'm going to go to the next slide and just show you the last two big slides are just examples of a message. Valor and equity. Thank you. It's Milka, I think. Thank you. Valor and equity. Yes. So one application of messaging, COVID-19 testing, lead with values. We care about all of our residents being healthy, and we need to start with the most vulnerable. Care. Identify the issue. People who don't have cars or access to public transportation may not be able to get COVID-19 tests. What's the historical problem? These are people who mostly live in lower income and often crowded communities. They are at greater risk for infection, so we have to get them tested. And residents of these communities are often mostly people of color. And then identify a solution. We can expand testing access by increasing test sites in vulnerable communities and offering mobile testing labs. Next slide is an example using broadband access. And this applies to North Carolina because we just did a presentation for a team in North Carolina. But lead with values. North Carolina has the opportunity to show that it is a leader in ensuring broadband access. That's authority. Identify the current issue. Broadband service during the pandemic has enabled remote learning and work, healthcare, and communicating with our loved ones. The historical issue, before the pandemic, everyone did not have the access they needed. 20% of households in North Carolina have no internet access, and 15% did not have computer devices. So what's the solution? There are lots of solutions, but we can increase community-wide access by doing things like investing in community networks, improving access to hardware, and using community centers as access points. So that's a message that you might put out. Next slide. So I want to end really in emphasizing the role of the importance of community in achieving equity. That equity in health will come from better representation, inclusion, and amplification of community voices and perspectives in the democratic process. Belonging to a community builds social capital, and we have to leverage that capital to engage in what I have heard recently called healthy political discipleship. It's about connecting our values to social justice. And remember this, when people have a strong connection to a group, an ideology, or belief system, they behave in ways that reinforce one of the moral values more than any other, and that's loyalty. And that's a really powerful way to create change. So last slide is just a summary of all the things I've talked about. And the only one I really want to emphasize is the very last one with the hand up, saying, provide people support to do it as asked. You know, if people can't comply with what you want to do, they're not going to be able to do it. So none of this matters without making sure that we provide people the support to be successful and healthy. So with that, I'm going to turn it over to Gary.
While Gary's stepping up, put your questions in the Q&A box. So Eloise has a tough question right out of the box. Good for you. We like tough questions. We'll see them. So be plugging them in as you go, and appreciate all of this. Gary, it's all yours.
Thanks. First of all, I want to begin just by honoring June Blue with modeling pretty much everything I'm going to say in the opening, in what normally is sort of a benediction. But it was the use of a deeply rooted tradition that is obviously deeply rooted in spirit as well as reality of the land and social networks, and telling the truth about how we are to be together. There was forgiveness and release and prophecy all built in. And you'll see what she did was an extraordinary, artful, and humble use of ritual and artifacts and symbols. It was really a beautiful act. And then Jean and Dawn have taken us to another whole place in being thoughtful about, let's call it the architecture of how we are to be together as people who share a space called public and how we can live lives that are about the life of that greater reality. So I'm very aware we're 46 slides in, and there are a few that I'm going to offer up that you don't even need to look at the words on them. They're just a few images. So let's flip to the next one. This is a zebra, a big hoss of a zebra. The key is you'll note the missing tail. If you are a zebra and think that you are big enough and tough enough to find your way by yourself in the savannah, you will probably have a large part of your tail bitten off. The core life strategy of the species called zebra is not to be big and tough on your own. It's the next slide. This is how zebras make it. This is actually how humans make it. No, they're in a crowd. You can't even hardly pick out one from the other. And you'll note they all have tails. That is public health strategy. I'm a Christian. It's also the body of Christ strategy. It's a vine and branches strategy. Any species that has been able to survive more than 2 or 3 generations actually has a social strategy. We are today in the middle of an epidemic, and we're very grateful that we are at this very moment. 65 million plus of us have benefited already from what really is a miracle of science to come up with an entire new scientific form of vaccine and get it into 65 million arms in the United States. That's damn near miraculous. Not enough, but we're underway. But the key is to understand medicine and science actually is mostly about activating the individual and the social immune system on purpose and in time. So flip to the next slide, if you could. When we talk about faith-based this or that, it's easy to think of faith institutions like not-for-profit organizations. Zebras sort of look like horses. They're not horses. They've never been ridden. They've never been employed to plow anything. Anybody who's tried to do that has probably been kicked to death by the zebra. Faith institutions are a little bit more like zebras in many ways than not-for-profit organizations. So you have to pause slightly before what you mean by faith-based organization. On the other hand, the fruits of faith-based organizations, which create the extraordinary rituals and traditions and philosophies that June modeled so beautifully for us, those traditions are very rich. The fruits of those traditions produce most of the institutional structures that we think of as populating our things. So this is the map in North Carolina. When we think of religious health assets, you can Google that phrase and it'll zoom you to an extremely rich website in Cape Town, South Africa. There's a whole body of thought about understanding religious health assets. And I'm not going to do those slides, but you can see it's a very rich array of different kinds of assets, including clergy, but also including lay people, the people who have been formed in their spirit by these assets. It includes all sorts of credentialed roles, chaplains, clergy, caregivers, church secretaries. All of these have associations that can be engaged. And these are all function in the community space, not just as things that do things, but they also serve as agents of signaling into the social space how we are present to each other, how we care for each other. And in fact, the other 6 values that Jean and the other presenters have highlighted, these are also the fruits of social signaling, not just the transfer of hard material assets. So flip to the next. That there's a fibroblast. I learned about this puppy when I tore my main tendon off my bone playing tennis. I don't know anybody else clumsy enough to tear a tendon off their bone playing a silly sport like tennis, but I managed to. And when I was recovering on my couch, I learned about how is it that the body not just connects, but reconnects. And fibroblasts are these little gizmos that are present all through the body, but they actually also move to the point of greatest injury. And at that point of injury, express just the material needed to bond together what was severed and broken. So for countless generations before we had high-end surgeons, we had fibroblasts. And obviously the metaphor I want to suggest is that congregations and sources of spirit are a little bit like fibroblasts in the body. They're not the muscles, they're not the bone, but they are the thing that connects and sometimes heals necessarily. And they are so omnipresent, they're already there when we need them. Just before this Zoom, I was Zooming on another call with North Carolina Governor Cooper's Advisory Council on Minority Health. And, just like your Department of Public Health, in normal times, these public structures manage to stay at a relatively comfortable distance from the inconvenient, mushy, whiny, argumentative assets called faith. And so we think we don't have much relationship with them, and we'll be separate. But I'll tell you right now, if you're the governor of a state in the United States of America and you're under extraordinary pressure to get vaccine into arms, including arms that have good reason to not trust the government, you'd better activate and remember that you do have a relationship with faith communities. So it was quite almost abusing and encouraging to abide by state. With producing materials on how to engage the human service organizations and doing special webinars on engaging your faith partners. Everybody knows where the stuff is when you actually need it. A little bit like fibroblasts. Well, guess what? Faith communities were already at the point. We didn't have to be sent. We were already there, much like fibroblasts. Now flip to the next slide, because there's no such thing as one fibroblast any more than there's one zebra. This is actually the way they work. So I think of this as a congregation of fibroblasts. They are social assets in the body, and faith communities are social assets in the body politic. In the body politic, we call public. The social assets, I love this line, make sure, because each of the words could be unpacked at some length. Common, distributed, adaptive. That is, they're not just instrumental, they're adaptive, responsive, connectional, humble, and smart enough to have invented us. The faith communities were there before public health. Think about that a little bit. Founding committee of the Minnesota Department of Public Health was probably opened in prayer, probably by some white Lutheran, but nevertheless a person of faith. And there were probably clergy that were in the political advocacy networks that were arguing that we ought to create a Department of Public Health. So faith communities are often the generative, if unlikely, political energy to see that the governmental structures expand as science expands, to do new things, to heal the body politic, and sometimes even heal the wounds that the very government has inflicted or been complicit with. So it's important to say that faith communities have a shadow side, as does every part of being human. Faith communities, many of which are toxic. Some of the largest flags on January 6th at the Capitol had Jesus on the flag. So part of the arts and crafts of engaging religious health assets is to be smart. The Bible says smart as a serpent, wise as a serpent, about the toxic agents that are within faith communities, but not to let the toxic agents steal the show. Common, distributive, adaptive, responsive, connectional, humble, and smart enough to have invented us, speaking as a person who works for a healthcare system, smart enough to have invented public health. We can find our way by working with not just the brawn of the faith communities. Sometimes they're called boots on the ground. I would insist they're also brains on the ground and intelligence on the ground about how to weave the assets to build the health that both science and God make possible to imagine. So let's flip to the next slide. You'll note this picture on the slide is the same way behind me. This is my wife TC's twin sister Lisa. Painted this sort of as a picture of the mind of God, the energy of God, and every different kind of place of gathering for worship. That's really the beauty of what I imagine. It's really hard to keep anything that would look like that picture in line and compliant in an orderly manner to achieve some set of carefully defined objectives. The Spirit goes where the Spirit goes, and it's up to us to be willing channels to capture that Spirit. Let's flip to the next, and then I'm sure you and me are both almost. Yeah, let's skip that one. That was a setup for another sermon that I won't give. Flip to the next slide. Yeah, this is really the takeaway I would wish. If there was one slide out of 50 that I would hope would live with you, is to look at that map of the places, the streets that you know and love and care far more than me. I'm very aware that the organizers of this call were also present 10 blocks away. 10 please. 10 blocks away, where George Floyd was murdered just some months ago. That horrible death called out an appropriate response from those who were present, some of whom were not at all surprised that happened. Some of those were broken and crushed by sorrow. And you would not be relevant to the urgent need of getting vaccine in the right arms at this moment. You would have no credibility before the community that needs the vaccine if you had not done the right thing in light of a community that stood in horror as one of its sons was murdered. So it's not just this or that program. It's not this or that little trick that we might do. It's not this or that message or vocabulary word that is over against the things that threaten the very life of our public. There's so much in public health that is animated and led by leading causes of life, leading causes of death. Actually, I'm suggesting that we organize ourselves around the leading causes of life. That's a fair fight. That's a fair fight. That's actually the fight that June was describing in the very opening blessing. All those were rituals of sustaining the cycles of life. That's a fair fight. That's a fight that any adult wants to be part of, even on streets that are much tougher than anyone from outside of St. Paul would imagine they could be. So I sort of want to end with that. I'm eager to be in dialogue about this. You are agents of life, channeling the forces that have flown through many generations of our ancestors for exactly this moment, for people that you know need life. I'm going to stop right there and look forward to the dialogue.
Okay. So I'm sorry, somebody else came on. So we're going to pop back on our video, the presenters, and dive into some questions here. So we do have time for some Q&A. And I want to start with the very first one that came in, which Jean noted, which is, how come conservatives were more likely to reject authority and the sanctity of human life when it came to COVID? For example, as not wearing masks, not staying home, and wanting to open restaurants. I have some thoughts on that, but I'm going to turn it over to the other panelists.
Well, I mean, I'll sort of take the first swing. You could say right off the top of your head too, why do liberals not value liberty when we're being told to do all these things? So you can flip these around. I think part of this has to do with the heated political environment that we're in, the way we do political messaging, and the fact that my brain is more comfortable with a simple lie than a complex truth. And the curse and the blessing of public health is we're dealing with complexities. We always make decisions. We never have 100% data, and the world is changing. What we say about COVID that we know today will change. So it is very nuanced and complex. And in this heated political environment, it is easy. Public health got weaponized over the past several years. It became a political weapon used by both sides of the political spectrum, and it is making it very, very difficult for us to function. But there it is a very tough question, and clearly, you can make those comments. You can make comments going the other way, and I don't want to try to do it. Public health has to draw lines, as Gary said. There's some things we do not tolerate. Racism in any form. We do not tolerate inequity, and we do not tolerate people being left unattended to. And it's very difficult in this world. But let me pitch to Dawn and then to Gary.
I will just say very quickly that, my understanding of Jonathan Haidt's work is that the values of loyalty, authority, and sanctity are really about preserving institutions. So when you think of it from that perspective, conservatives are more inclined to want to take an action that will preserve the institution over ensuring individual justice. And what that looks like is that it's not to say that someone doesn't value wearing masks. It's that they value something else more. If they value their business being open, they value being able to see their family, preserving the family institution. Maybe it's preserving the institution of education and having their kids be able to go in person to school. So, I would just encourage people to think about just that balance between wanting to preserve institutional norms and wanting to preserve individual justice.
So just because it's late afternoon here and to keep things lively, I'm not sure that public health throughout its history has often been on the side of privilege and domination. I'm just thinking of the Native American people who were victims of public health that essentially took away many of their traditions and were part of the weaponizing of the other. It was just simply part of the systems of domination. And so the roots of public health are not just in pristine science for the good of the public. From time to time, it has been complicit and part of the ugly domination systems, as has every faith tradition. There's not a single faith tradition in the entire world that has proven incapable of being weaponized against the people who you would think it would protect. So I speak as a white Baptist, and my predecessors wrote tracts about why slavery was okay, and we were part of the politics of domination, and we somehow were able to be made complicit in the very things that would have made Jesus roll over in his grave as a brown Middle Easterner. So I would just sort of part of the challenge of the work that we are in this very day is to protect, but also be humble about the very best threads of our own traditions. And the first job of someone who's part of any tradition, whether it's a tradition of science like public body, is to make sure that your tradition is actually safe for the world. Someone who's outside the Baptist tradition isn't much help in policing the Baptist tradition. Someone who's outside of public health doesn't have a whole lot of credibility in order to help make sure that public health actually is a servant of the people. So our first task as a person of faith is to make our own faith tradition safe for the world. And then we can get on beyond the do no harm to being part of the collective salvific work that I described early on. So.
So I think this next question may build on the idea of how we get to do no harm. And I'll start with June, if June is with us still, June Blue. The question is, today we talked about messaging, and it has been difficult to see recent events where certain audiences are targeting Indigenous communities who are calling for the removal and changing of names and structures and symbols that are examples of the pain and damage that some historical members of dominant culture have created in our Indigenous communities. I have had a difficult time explaining this, as some feel like it's an attempt to erase history. Can you share with us your perspectives on how we can better talk about these issues that feel so polarizing?
So maybe to get some clarification on the question. There is a lot of polarization, and even within our own communities. And I don't know if I'm addressing this directly, but we even sometimes will, like I had a niece over in Minneapolis that said she had been to a meeting that said that some of the people were saying even you have to get vaccination, and she's younger, and she was like, I appreciate that perspective, but saying either or is not going to even assist people, and that we have to come from especially as leaders and elders, like coming at from a perspective of humility. And so, yeah, I don't know if I answered that question correctly, but, that's just my thought process.
June, I think the question, now that I've gotten some clarification, is, in talking about taking down maybe statues or symbols that are related to Indigenous peoples and cultures, that in doing so, we're somehow erasing history. That there's a tension between them being, those symbols being misused and wanting to preserve history in a certain way. And how do we have conversations about that, about the use of symbols that are related to communities and peoples, and the challenges that people have posed to those?
Well, for me, like, I feel like the Indigenous population is 1% of the United States right now. And so I feel like not only should we keep these symbols and our culture and traditions, not only should we keep them up, but we should be building more. And for example, like for me, honestly, like I don't know if I would be doing this work if there was like a lot of people doing this, like, but there's I feel like there's so few of us that we have to stand up and we have to say, well, this, to tell our own stories, and we have a right to have these monuments and express ourselves in the way that we want to. And I do that. I've carried the Eagle staff to meetings, and I'm sure it made a lot of people uncomfortable. But right now, I don't really care. I'm a grandma, and so I feel like we should be able to show ourselves and to honor ourselves and to carry ourselves with the greatest respect and honor and dignity. So,
if I could just add on that, June, because I think you're absolutely right. And the question is, well, why does June get to carry the Eagle staff and I can't carry a Confederate flag? And the answer to that is, some of these symbols have been weaponized for hate. You're not carrying that Eagle staff to that meeting for hate. You're carrying it in love. And it was different.
Yeah.
Right.
I think that actually builds on the
Thank you,
next question
Jean.
that's in. Yeah, thank you, Jean and June. I think that actually leads us to this next question that's in the chat box, which is about this polarization and why are some people marginalized and called intolerant when they stand for their values, which is different from others' values? That might be a difficult one. I don't know who wants to start with that.
Well, yeah, I mean, I will start. I don't see these in the chat box, but that's okay. I got it. Yeah, it is hard. Again, sort of where is the humility and where is the understanding is part of it. And is this being done to really harm others? It's one thing to have free expression. It's another thing. Is this a symbol that's being used to oppress? That's sort of part of it.
I would add to this second part of the question. I think I was just on a webinar earlier today that was talking about the role of lawyers in civic charity, and it was really fascinating because it connected it to history. But it was really about our role as leaders and creating civil discourse, and how different points in our history, our democracy has been threatened by exactly the kinds of things that we're seeing today. And, I don't know that there's a clear answer, but some of it is, we've become so entrenched in our own views and have failed to create an environment where it's safe to express different views, but also where we recognize how our views impact other people. And so, part of that is having experiences outside of out of our own. So like being exposed to different people's cultures, places, etc., which is even harder to do during a pandemic where most of us are not able to travel and do things and experience things. But those are all things that we know enrich our experience and understanding of others. And we see the impact of social media and reinforcing these silos that now exist between us. And so we have to really take action and really hold these companies accountable for saying, how do you create an environment that fosters respect and care for other people, and not the opposite, which is what we have now.
Gary, you're muted.
You'd think by this time in COVID, I'd figure that out. This long journey, 5 years or so, of the better messaging work, of which this webinar is one part, started as a work of crafting better messages. Yeah. Every step that it's gone forward, it's gone in the direction of becoming not just better people, but better listeners. And I think there's our religious traditions are actually all about humility before the extraordinary majesty of the created order of which we are part. But all of these traditions can also be weaponized. It turns out easily weaponized. I mean, just shockingly easy to weaponize them. But I just sort of underline that we need to focus, not just talking about, but embodying really the arts and crafts of humility and being humble before each other, especially those that we find it annoying to be around. I was just thinking, Jean, when you commented on the legal power of public health, one of my favorite passages by the Apostle Paul is in Galatians 5, and it's about the fruits of the Spirit. And it says, the fruit of the Spirit, and I would say every spirit, not just the Christian spirit, but the fruit of the Spirit is love, joy, peace, forbearance, kindness, goodness, faithfulness, gentleness, and self-control. And then he adds, against such things, there is no law. So it's sort of interesting to put the fruits of the Spirit against which there are no laws. up against the work of public health law and trying to figure out, well, how do you do laws that protect the space for the fruits of the spirit to be expressed? And that's actually what I mean by religious freedom, the freedom to express those kind of fruits.
Wow.
So
You ready for the sermon, Robert? That's good.
Yeah. We're going to shift gears slightly to another question, which is, what is the plan of action to encourage public trust in the COVID-19 vaccine, in particular in traumatized communities of color?
Oh, I would go with that right off the top if you want. June, were you trying to get in? Did you have a comment a minute ago?
Well, no, but maybe on the plan of action. And, I feel like it's not just one thing or the other. It can be a two-pronged approach. And one of the one thing is especially is even to work backwards and try to do whatever we can to heal the trauma that we've caused, and then at the same time be really good listeners.
Yeah.
And so wherever someone from public health goes into a space, just I feel like to be ready to listen. And again, that's the mainstream thought process. Like those two opposite. It says that we're goal oriented. That's mainstream thought process. And for us, it's not goal oriented. It's like, the whole community, like we don't have a goal, like, per se, but the goal is that people feel comfortable. And for me, that is going to be listening and hearing the stories of people. And if they decide to get the vaccine, that's their decision. But just to know that I went in there with my heart, and then I shared some things, but I mostly listened. That's what I need to do.
Yeah, I would like a piece of that and then pitch to Dawn and then to Gary, because there's so much in that question about, in particular, to traumatized communities of color. And this is here the communities where George Floyd was murdered in living color. As to the public health piece, I came to CDC 40 years ago. And one of the first legal jobs I had to do was help stand up and implement the Tuskegee Syphilis Study Compensation Program, which is one of the big issues. It wasn't the only, it wasn't the first, but how public health was used in a way that was totally unethical and immoral. And there's nothing to do but admit that. CDC was basically saying this was a mistake, not to alibi out, not to pivot and give a soundbite. It was wrong. And they inherited it, but the public health community, the public health service, did this back in the 30s. And you see this with, Henrietta Lacks and in the 1980s and her cell line being used, and her family didn't even know about it for various purposes. So you have plenty of, I think, Gary, your mic is on. Your mic is open. The other part, in addition to the acknowledgement, is to ask the question, why do you feel that way? Not you're wrong, not that I've got a peer-reviewed journal article, not that I can show you the data on what the effectiveness of COVID. We get preachy and screechy in public health, but to listen, why do you feel that way? I'll pitch to Dawn and then to Gary.
I'll just say a couple of quick things. One thing that struck me about Indigenous communities, and I come from New Mexico, where the Navajo Nation is the largest tribal community, but there are 23 federally recognized tribes, pueblos, and nations there, was the importance of valuing elders and preserving the community, and that getting vaccinated was one way to help preserve the community. I thought that was just really powerful. The other thing I will say is that we see there are lots of doctors coalitions, doctors of color, Black and Latinx doctors, who are coming together to speak to their communities. We know that people will trust their healthcare providers and healthcare leaders in their community more than maybe national figures or people who aren't known to them. So that's been important in trying to get the message out. And the other thing I will say is that there are some really good resources. So I put one in the chat called Power and Immunity, Information for Protecting Our Bodies and Our Communities, that was put out by the American Lung Association and the Center for Black Health and Equity. There's some great tips in there on how to reach the Black community about vaccines. Salud America also has some great resources. They have the Juntos We Can Stop COVID-19 campaign, and they also recently just promoted some of the CDC Spanish language webinars about the vaccine. And Berkeley Media Studies Group is also another organization that has put out some information on messaging around the vaccine and racial equity that is really important. So I can drop those other links in the chat as well, but I thought I would mention them because they are great resources.
Gary, speak to the trauma.
Hey, guys. A couple of very practical things. Make sure that the authorities are setting aside vaccine and creating the relationships with the networks closest to the ground that can help get it in the right arms. There's some of that going on in North Carolina, but we're still sort of early on in the process. So it's very, very concrete. Are you making the vaccine available, and are you actually making it available by building functional webs with those groundworks? Are you hiring community health workers? Which ones? Are you hiring them from the community? Or are you airdropping them? These arts and crafts relating to traumatized communities, when you need them, is the worst possible time to create them. That's what we keep learning over and over and over again. Yeah, but they're there. I put in a link to my favorite model exactly about this. Is a link to a radio Onda de Amor. It's led by one of my supporters of health, a kind of community health worker, Enrique Catana, who works for us. In his part-time, he stood up a web-based Christian radio station in Spanish. He's a dreamer from Mexico. And he did this partly because he loves the music and made it available online. During COVID, I asked him if he'd be willing to take the radio station that he had created and turn it into a vehicle for communication about COVID. And, don't stop playing the Christian music and don't stop praying, but could you get COVID in there too? And I made the only administrative function was to free him to spend some of his time during the daylight hours as a community health worker to take advantage of his skills as a communicator. Well, Radio Onda de Amor now has thousands of listeners. So who does he interview? Well, he interviews everybody and their dog who has anything to do with getting treatment and testing and now vaccine into the lives of people who have very good reason to not trust the government. In fact, it's dangerous for them to go anywhere near the government. They're undocumented. So he's really modeled what it means to use faith as a proxy for trust and extend it into the lives of those who do not trust. So I invite you, you pretty much need to speak Spanish to fully enjoy it. But if you follow the link, it's just a gorgeous example of doing the right thing.
Dawn, you're mute.
I am muted.
Oh,
go ahead, June.
Okay, just one again. Mainstream thought process is goal oriented, and then the indigenous process is process oriented. An example is a gentleman. His name is Eduardo Duran, and he actually wrote a book called "Healing the Soul Wound," and it comes from therapy from a perspective, indigenous perspective. But one of the things he said, he had been in the military for 12 years and then went to a Navajo reservation down south. And they said, oh, gee, now we got a therapist and he's got his doctorate and yay. And so but the first thing he sent out a survey to everybody on the reservation. And he sent that survey out, and then, he waited a while. He thought, I'll wait a while. He waited like 3 weeks, and then he went to one of the elders, and he said, "No one answered the survey. No one even returned one survey, and I just don't know what's wrong with these people." And he's Native, and so long that he forgot that everything is relational. The elders told them, they said, they're not going to answer a survey. You have to go out there and you have to talk to people and you have to talk to everyone. And so, again, it can be even more than a two-pronged approach with the Indigenous people. And this is my perspective, but one of the things is to have everything set up so everybody has access, whoever wants it. And if there's elders going to get vaccinated, and then there's like tribal chiefs or chairmen, and telling people to do something for our culture that's the fastest way to get us to go the other way. So if you show like this is how I'm going to act, and this is what I do. Before I got my vaccine with Fairview, I did a lot of looking and researching, and I decided, since some Fairview had actually vaccinated like 22,000 nurses and doctors, the frontline people. And I thought in my head, if they're willing to put their frontline people on the line, then Fairview stands behind this. So that was my thought process. And everybody, and we're deep thinkers. We don't just like goal oriented. It's a process. So just to realize that with Indigenous people, and we have a different thought process sometimes than the mainstream culture, or even our Black relatives or our Hispanic Latino relatives. We have a different perspective. So just to keep that in mind. And I appreciate all the work you guys are doing. Miigwech.
Thank you for that, June. I don't see other questions in the chat box. And so what I want to do is, if you have another question, you're welcome to put one in. We do still have a few minutes left where we can answer additional questions, take comments. But what I'd like to do is also pose to the panelists, what would your parting thoughts be for the audience today? What would be one last thing that you would want to share?
If Sarah's listening, go to the last slide, because I want the very last slide at the very back. And that'll be for the close. Go all, yeah. So I was so struck. I had put this in for the earlier program, but I didn't think I would be using it today either. I don't darken a lot of church doors raised as a good Presbyterian boy, but my weakness is good choral music, and I have not missed since I've been here, except for COVID, participating in the community Sunday, the community for 53 years. There's been in Chapel Hill a community Messiah Sing. Students, and usually right before students go home for the holidays. And so, God knows she's got an ace in the hole with me on choral music. And so I was struck by this. And then I'm struck by, June, you talked about sweetgrass, about bringing good things. And it just chokes me up. This is the before the Hallelujah chorus and all that drama goes, there's this beautiful soprano air followed by a choral response. How beautiful are the feet of them that preach the gospel of peace and bring glad tidings of good things. And then this wonderful fugue swells up out of the choir. Good basses, love it. Their sound is gone out unto all lands, and their words unto the end of the world. This is about you are, it's not, God's sound or the sound, it's their sound, the sound of those preaching the gospel and bringing the good tidings of good things. And that is what we in public health do. We are preaching the gospel of how to do good and bring glad tidings of good things. And of course, those of you in the faith community do likewise. But Jen, I'm just touched by you go to that as part of your own wisdom from your elders with the sweetgrass. So I'll pitch it to you for closing. Oh, that's about as good as I've got. I do have a close. Go ahead.
So I come from a grandmother point of view, and that is very, very compassionate and very loving. And but then a grandmother, sometimes and then sometimes the mother is. And so I come from both of that perspective, and just to realize like the harm, and it seems to me like there, I remember we did we were doing a model for M Health Fairview Cultural Brokers, and we had Black, Hispanic, Latino, Karen, Hmong, and Native Indigenous, and we said, what are we going to do? And the woman who was Black said, well, we're going to teach this these things about some of the knowledge that we have. And I said we don't teach in our community, we share, and and then she said, but you know what, she said, education has been held from us. Like if we were to read a book, we would be beat and even sometimes killed. Like if they knew that. So we come from the perspective of teaching and education. And then I said, education has done more harm to my peoples than just about any other form of genocide. The boarding schools where my grandfather and my father went, education is the most vile, the most vile thing that you can imagine, like what it's done. And so, and it's not, and we sat there and we talked and we listened to each other. And I was like, wow, I didn't think about your perspective either. Because we thought as people of color, like we're on this, right down the line, everything is the same. Think about that is even we all have our own journey and our stories to share. And again, that all the four colors are evenly balanced. All those four colors are evenly balanced, and not one has more say than the other, but they all come together in the middle. So I say in Endam Pendigo Day, I think with my heart. And that is where I first come from with anything, is I come from my heart. And I don't know. So that is kind of my my ending is just to say, like, I think and I listen and I come with humility. And I hold, and one other thing I wanted to say is that a lot of times we think we come from a place of privilege. I got my doctorate. I got my, I'm the CEO of a company. I work at the county and I'm head of, all this. And we have to start coming from the thought process of not privilege, but responsibility. So anything that you think, and I feel everybody here does that, but if you ever think like you're privileged, you flip that around and you think that is my responsibility. And what are you going to do with that responsibility to the most beautiful 10th degree. Like it's so amazing. But if as public health work, we have to come as not a place of privilege, but as a place. I'm not a public health worker, so I work a lot with public health. We have to come from a place of humility, and this is our responsibility, but not matriarchal or patriarchal, or not patriarchal responsibility. But how can we serve the community? And that's it.
Dawn, you better jump in. You don't want to follow Gary.
I don't want to follow June. How do I follow that? I just have one very brief thing to say, which is on the point of humility. And something I heard today, and I will share with y'all because it resonated with me as somebody who is trained in alternative dispute resolution, which is we have to identify what is core to us as individuals and recognize what is core in others. And we have to be willing to compromise on the things that are non-core for us. So right now it's like we're just putting a stake in the ground and saying, this is what I value. But the reality is there are some things you can let go, but there are things that really, really matter to you. Hold on to those things, but be willing to compromise with others on the things that are not core for you. And I'm going to give you a cheesy example, but I mentioned ER. Did I mention ER earlier? I don't know. But maybe it was Grey's Anatomy, but there was a scene where like a couple was debating over a house, the purchase of a home. And the husband really liked it, and the wife didn't. And she was really resistant. And it really was bringing him joy. And finally, it came down to, she said, you know what? It doesn't matter to me where we live as much as it matters to you. She's like, I just want to be with you, but you clearly love this space. And so they were able to move into that space. But it took like the whole episode, right, for them to figure out that they had different core values that, were able to live together. So that's what I would say. Be willing to compromise on the things that you can.
Reverend?
I'm smart enough to know the amen moment. And I think we already had it. I just paused before the wisdom of these two brilliant women. And Jean, you've been one of my teachers for many years. And I only wish we were together as a group of 40 people. I suspect we would find that we share many, many, many common elders and many common hopes. So I'm very grateful for the time together today with we so often look to the people of Minnesota for leadership, and it's actually quite humble. I feel quite humbled to have been asked to come to you and help you become more who you already are. So thank you.
Wow. Sarah, can you take us to the 3 takeaway slide? We can jump out of here unless Dawn, anything else you see? So I'd put this in long ago, but it sure fits from what we just did. 3 takeaways to me are local government, community coalitions, public health has this vital role to play amid all this polarization and this dealing with health equity. Number 2, local government, local coalitions, public health, faith community can't afford the luxury of contempt or condescension towards those in our communities who don't happen to share our political viewpoints, our ethnic viewpoints, our religious viewpoints. We cannot afford that luxury. That's the humility. And number 3, we need to build the skill sets for our entire combined workforces in order to make the changes in law and policy and culture, in getting the refunding done to meet these new challenges. So I step away with no less than, you can't do much better than John Lewis. Try to find the goodness in every human being and don't ever give up on that other person. So I'll leave it with that. I got nothing more. So back to our organizers.
Thank you so Jean, for helping us end on that note. I really want to extend a thank you to our amazing presenters, June, Jean, Don, and Gary, and to my partner in this work, Sarah Rogers, who I have the pleasure of co-leading our collaborative's policy work group with, and who really has been a driving force in making today's event possible. I also want to thank you, our participants, for attending. Once the webinar ends on your end, an evaluation will pop up, and we would love to hear your feedback, and thank you in advance for your participation. And lastly, I wanted to share that we will be making the presentation materials as well as a recording of today's event. We'll make sure that we share that with all of our attendees. We're going to clean up the audio a little bit as we did have some technology glitches. No virtual event would be complete without a few technology hiccups. And we'll also include a link to take the evaluation if you don't have time to do so today. So with that, I will say thank you so much for joining us, and bye for now. Take care. Have a good afternoon. Thank you.
Thank you, folks.